we're where the need is, and that's where we go. We've been serving suburban King County since 1971. Our clinics are always located in areas that are easy to find and access for people who are low income, underserved, uninsured. They're very diverse populations, both racially and ethnically, as well as income-wise.
My name is John Hord, and I'm a patient at HealthPoint. Today, I do see the pattern that I lived my whole life. Depression, loneliness, and isolation just caused me to just drift away and not be happy or content with anything I did in life.
My dad passed away when I was 6 years old, and my mom was a single mother with 4 children, and she decided to come back to the U.S. My family only spoke Spanish. It was definitely a shock.
My name is Julio Pocon.
And my name is Mirta Pocon. We have 4 kids.
Our whole family goes to HealthPoint.
It's difficult to say there is a single reason that people are in need. People lose loved ones. People find themselves, for no fault of their own, out of a job. And the why they're in need, in many ways, is beside the point. The fact that they are in need and the fact that there are ways out of need is really the point.
I was in a relationship and I ended up being pregnant very young. We didn't have insurance, we didn't speak the language, so we obviously needed a lot of help. And that's where family and friends told us to go to HealthPoint. It made us feel welcome.
Without HealthPoint, a lot of folks would slip through the cracks. If you have a healthy community, you have a thriving community, people are able to work, people are able to go to school.
If HealthPoint weren't around, there are many people who would not get their medications, whose chronic illnesses would continue to worsen, who would spend much more time in the emergency room and not be healthy and productive.
Without HealthPoint today, I'd probably be back in the streets of Seattle. I have not ever in my lifetime heard of another clinic that services all the different medical treatment a person may need.
The patients who come to HealthPoint have a healthcare home.
We have behavioral health, we have client services rep who helps patients to access community services, dental care, acupuncture, we have natural medicine services, a nutritionist, and nursing care on staff, in addition to your run-of-the-mill family medicine provider.
Our goal is that every HealthPoint patient that's in medical could be one of our dental patients, but as we are now, we are not right-sized. So we are trying desperately to expand our clinics to try to accommodate more of our population and keep everything in-house.
I think the model of healthcare that HealthPoint has is the model of healthcare for the future. It's comprehensive, it's patient-centered, and it's designed to help people get healthy, stay healthy, and be healthy.
Our doctor is Dr. Skinner, and I love her because when she delivered my baby, she knows what is she doing. I talk to her in Spanish. It's good because she can understand me.
Yeah, soon after I started going to HealthPoint, I got connected with Anya Zimberoff. And that relationship has evolved into almost like a lifeline for me.
As a patient in HealthPoint and just seeing that they really made a difference in people's lives, I knew that eventually I would want to do something like that. They knew I didn't believe in myself, and they started encouraging me. I started volunteering for them. Then I became the interpreter, and now I'm a client service representative. For me, providing those services to others, I want them to feel comfortable like I did when I was a patient.
I think what I see are hardworking families, yet they're not benefited with healthcare. So these families, I feel like, need a break somehow.
We know that HealthPoint will do everything it takes to take care of us, and we appreciate everything they have done for us.
You know, the greatest thing in my life today is this little girl knows where her daddy's at every night. With the help of HealthPoint, she doesn't have to worry no more.
HealthPoint has made a difference in my life, and I truly feel like it was my salvation. I'm Yesenia Moreno, and I am a client service representative at HealthPoint.
One reason I stay is we have a great staff. Hardworking, caring, compassionate. I get a little emotional because they are a great group of people.
Community health and HealthPoint in particular has been wonderful at allowing physicians to practice medicine in the way that you thought you should practice medicine when you went to medical school.
We talk about the need in our communities, and we talk about the numbers of people who are underserved. But when we get out and we get into the communities, all those numbers really do come alive. They are people, they are souls, they are families, they're our neighbors, and they're our friends. And it really underscores the meaning of what we do.